Now, for something a little bit different, Professor Bob Elliot is a rock star. I first met him as a law student because he was involved in the seminal case of Daganayasi, which was all about an immigrant, and it was an immigration law case. But I have subsequently come to work with Bob because it took 14 years for Bob, who founded and is the medical director of Living Cell Technologies, to get permission to run trials. And these trials are to take Auckland Island pigs and you put islet cells in them and they grow insulin. And then you put them into humans, and this solves the global epidemic on diabetes. So I am pleased to say that Bob is now winning every award, but of course during the tough days, Bob, everyone said you were mad. And now, of course, they say you're a genius. So come and tell us all about how you found interfacing with government. The Honourable David Cunliffe was a big part of that interface, and he slipped away. I was going to let him have his side of the story. And then finally, it was the Honourable Tony Rowell who gave the consent.
Well, thank you very much, Mai. And yes, the outcome of the immigration law thing actually came out okay in the end. The mother of the child was allowed to stay in New Zealand, and the child did receive proper medical attention. So this was the case that she wrote up for her thesis. Well, what I'm going to talk about may sound a bit like a shaggy dog story without a humorous end, but it is a convoluted story, and it's one that faces all innovative and profitable biotechnology outfits in this country. In 1996, after nearly 40 years of looking at this problem, I shifted from an academic institution to a company called Diatrans, and we transplanted 2 severe diabetic patients with insulin-producing cells from pigs. Rejection was prevented by coating the cells with a seaweed derivative, and no anti-rejection drugs were used. Both patients showed a modest clinical response directly attributable to the transplant. Permission to do this was gained at that time from the regulatory body MedSafe and the relevant ethics committees. It was planned to build on these experiences, but in late 1996, a London-based research group showed that a provirus that is present in all pigs could cross to human cells in the laboratory, raising the spectre that transplanted pig cells could become a source of a new pandemic with human-to-human spread. The provirus has the rather unfortunate acronym of PERV, Pig Endogenous Retrovirus. All pig cell transplantations stopped, not that there was too much going on apart from our lab, while this possibility was explored. Since that time, an exhaustive series of human observations and experiments in monkeys has shown this infection just doesn't occur, even when the pig virus is injected in large amounts on many occasions into humans. So it just doesn't happen. It was a red herring. Nevertheless, regulatory bodies around the world adopted a super cautious approach, and national moratoria still exist in some countries. In 2001, a Royal Commission here in New Zealand on genetic modification mistakenly made a recommendation on this process of putting animal cells into humans. It's not a genetic modification, it was really none of their business, but they made a recommendation nevertheless, which resulted in a change to the Medicines Act that produced a virtual moratorium on this process, reversible only for clinical trials subject to the approval of the Minister of Health on advice from the Ministry. An application was then made to MedSafe, the same organisation again. The company had changed its name to Living Cell Technologies, and we wanted to extend the human trials when it became apparent that there was no real risk involved. A period of several years passed while a pathway forward was designed, starting with an extensive nationwide public consultation on the acceptability of animal to human transplantation. And what happened was that in 2005 to 6, the Bioethics Council made a national public consultation. What was said at the time was the Maori are going to say no, and if the Maori say no, it's not going to go ahead. To everybody's surprise, Maori said yes. In 2006, a revised application was made from our company to the Gene Technology Advisory Committee, even although it's not gene technology, but that was where it was supposed to go. In 2007, the New Zealand Regional Ethics Committee and Allied Maori Committee were consulted and gave approval to go ahead. Sandwiched in between all of these were two parliamentary committees of inquiries, one open and one closed. 2008, the National Health Committee was again conducted a further nationwide public consultation. 2008, expert international advice was gained from the Centre for Diseases Control, and 4 Ministers of Health later, in 2009, we finally got ministerial approval to conduct the trial. Blessed be Tony Ryle forever. And the trial got underway in 2009. Now, the clinical trial period spanned a period of 17 years from its inception. A further 6 years was spent on taking the concept through preclinical trials. So that's 23 years, and over this time, $85 million of investors' money, the great majority from international sources, has been spent. 6 of these years were spent getting regulatory approvals to proceed with the New Zealand trial without any real advance in the technology. I think it's fair to say that very few, if any, New Zealand biotechnology companies could expect to last this long. We were very fortunate in being able to attract money from people suffering from diabetes mostly. They're the ones who became investors in the company. We did have a little support from the government, 4 million out of the 80 odd million came from the government, and more recently we've had a rather large infusion of money from a Japanese company who are very interested in technology. If New Zealand wants to foster biotechnology in New Zealand, research and development up to including a marketable product, shortcuts to the regulatory process and better availability of funding will need to be instigated. This is, however, a success story, and it's put New Zealand in a very strong position internationally in this field of diabetes treatment. It is the only company in the world that has attained this end. Thank you.